my name is Mackenzie and I'm going to be showing you how to do oral suctioning and oropharyngeal suctioning today. So first what you're going to want to do is go into your patient's room. You're going to want to assess them if any gurgling is present, decreased respirations, or a decreased O2 stat are good indicators for your patient's needs of suctioning. After that, you're going to want to assemble your supplies, which I have done. Next, you are going to go into the patient's room. You're going to identify yourself to the patient and then get 2 patient identifiers from the patient themselves. You're going to explain to them the procedure you're going to be doing and then how they can assist you with that. So now what you're going to want to do is make sure your suctioning is turned on to 80 to 120 millimeters of mercury. And how you're going to test that it's properly working is put on a clean glove. Pick up the end and just lift your thumb and just make sure that suction is working. Now you're going to remove this glove, wash your hands, and provide privacy for the patient. Next, you're going to want to assist your patient into a semi-Fowler's position. If they're conscious, you want to turn their head towards you. This model's head doesn't turn, but ideally that's what you would do. And if they are unconscious, you want them laying in a lateral position facing you. So now I'm going to go ahead and put on my gloves. Going to grab my anchor, attach it to my suction tubing. Going to moisten the tip. And I'm going to insert it into the patient's mouth, making sure that I'm on the outside of the teeth, staying close. You don't want to suction any of the soft tissue. And after it's all been suctioned, you can take it out. And if that's all that needs to be suctioned, then you're done with this. But if it needs to be resuctioned, all you have to do is re-moisten the tip of your yankar and insert it back into the mouth and start the procedure over. So now I'm going to be showing you another technique. It is the oropharyngeal. You're going to want to again go into your patient's room, assess them for any signs and symptoms of decreased breathing or need for suctioning. You're going to identify yourself to the patient, identify the patient with 2 patient identifiers, provide privacy again, hand hygiene, all the same kind of stuff. The only difference is this time you're going to be using suction tubing that looks like this. You're going to attach this to your wall suction tubing. You're going to lubricate the tip. And now you're going to insert this into the mouth towards the oropharynx about 3 to 4 inches. And when you remove, you're going to want to suction intermittently. About 10 to 15 seconds is how long it should take to remove. If you need to go back in and suction again, all you have to do is re-lubricate the tip and go back into the mouth. And that's it. After that, you'd want to document everything you found, all the secretions that were excreted, the color, consistency, that kind of thing. And that's all. Thank you. Okay. For the second part of my video, I'm going to be demonstrating how to do nasopharyngeal suctioning. Again, you're going to want to assess your patient. You're going to look for the same signs and symptoms that you would with oro and oropharyngeal suctioning. Again, you're going to gather your supplies, which I've already done. You're going to then go into your patient's room, introduce yourself, identify your patient with 2 patient identifiers, and explain to them the procedure and what's going to be going on and how they can assist you. I have a tech with me here today. She has performed hand hygiene and has on clean gloves. So now what I'm going to do is I'm going to make sure that my wall sectioning is on to 80 to 120 millimeters of mercury, and that it is functioning properly. And now I am going to go ahead and open my sterile field, or my sterile kit, towards me. I'll reach in, grab my sterile gloves. I'm going to apply my dominant hands gloves first. I'm going to pinch the inside. Slip my hand in. Now with Hitchhiker Thumb, I'm going to grab the other glove, slide my hand in. Okay, now I'm going to take out my sterile water, or sterile saline, open it, and I am going to grab out my sterile sectioning, and I'm going to use this to measure how far I need to insert this into the nair of my patient. And it's about 21 to 22. So now I am going to lubricate the tip. And attach to my wall sectioning. I'm going to insert this into either nostril, it doesn't matter, along the bottom of the nasal cavity. I'm going to insert this 21 to 22 centimeters, or until I feel resistance. As I am pulling the nasopharyngeal tubing out, I will be applying intermittent suctioning and twisting the tube. Okay, now that it's out, I'm going to assess, make sure the patient doesn't need any further suctioning. Possibly they may need it in the other side of their nostril. If they don't, you remove it, wrap it in your gloves, dispose, and you're going to document everything you've done. You want to document the stuff that you have drawn from your patient, the color consistency, all that kind of stuff, and then you're finished with your procedure. Thank you. Hi, it's Mackenzie, and for the third part of my video today, I'm going to be showing you how to do endotracheal suctioning. So what you're going to want to do first is you're going to want to assess your client. You're going to want to assess them for any congestion, and then any auscultation of their lung sounds, and that would be a good indicator that they will need this kind of suctioning. Next, what you're going to want to do is assemble your equipment, which I have done, and then after that, you'll want to go into your patient's room, identify yourself to the patient, identify the patient with 2 patient identifiers, explain to them the procedure and why it is necessary. After that, I am going to want to make sure that my wall sectioning is on and at 80 to 120 millimeters of mercury, and at this time I'll put on a clean glove, test my suctioning to make sure there's no malfunctions. I'll remove my glove to perform hand hygiene, provide privacy for my patient. At this time, I can apply any gowns, masks, goggles, anything to decrease the amount of secretions on my person. I will also want to position my patient in a semi-phallus position as to increase the comfort for them. I'll then want to hyperoxygenate and place a towel on their chest. After all that, I am going to set up my sterile field, moving my gloves. I'll start with my dominant hand first, using a hitchhiker's thumb to apply my non-dominant hand. Okay, now I'm going to open my sterile saline. Suction catheter and apply to the suction tube. Okay, I'm going to lubricate the tip. And now I'm going to instruct my patient to take 3 to 5 deep breaths before I insert the suction catheter. Okay, now I want to insert quickly but gently, 12.5 centimeters. And to prevent damage to the mucous membrane at the bifurcation, I will remove 1 to 2 centimeters before suctioning. And now I'm going to intermittently suction while twisting the catheter every 10 to 15 seconds. Once the suction has been completed, you want to reassess your patient for any further signs of congestion or needs to be suctioned. If there is another need for suctioning, you can re-lubricate the tip of your catheter and wait 30 seconds to a minute between suction times, but don't let that go over a span of 5 minutes. My patient is currently in good standings and doesn't need any further suctioning, so I'm going to remove the suction catheter from my wall suction and discard of it in my sterile gloves. And now I am going to reapply my oxygen. And make sure that it is set back to pre-procedure settings. I'm going to ensure that my patient is comfortable and all safety measures have been completed, and then I will document all the data I've retrieved. Thank you.